Welcome to the Healthy You, our conversation with Dr. J, where we keep it real, we keep it fun, and we keep it green. Hello, my green family. It's Dr. J, your favorite vegan physician who believes your plate is more powerful than your pharmacy. Welcome to season 4. This is our first episode of the Healthy You this season. And what we will talk about today is protecting your heart naturally. I have a guest who is a holistic cardiologist, and she will give us her blueprint for the prevention of heart disease. Welcome, Dr. Mona Shah.
No, thank you.
Hi.
Be here.
She's a board certified cardiologist, board certified in holistic medicine, board certified in cardiac CT. Her training is at the University of Chicago, University of Cincinnati, University of Kentucky, and Ohio State. Welcome.
Thank you so much. Thanks for having me.
Okay, let's get started. So, can you tell us a little about your journey into cardiology and what led you to embrace a more holistic approach to heart health?
Sure. Cardiology. So my background is engineering, and you learn to think in my undergrad degree, and you learn to think very differently as an engineer as you kind of progress through your education. And when I started medical school and then started doing my rotations and all that, I really, really leaned towards cardiology because I felt like there was a lot of, if you have this problem, then here's the solution, and these are the different paths. And that's kind of how my brain functioned. And so I lent towards cardiology. And then as I started practicing, I've been practicing now for 20 years. So, and I've been board certified in holistic for about 16 years. It's been a long time. But so I noticed as soon as I started practicing in the real world after fellowship training, the way the traditional model trains you is, someone comes in, as you know, Dr. J, with symptoms, and you do your appropriate labs and your testing. You go over that with them. And a lot of times you don't find necessarily answers, or not the answers you thought it might be. And then you and the patient are kind of left with, I don't know, maybe it's not your heart. Go back to your primary. And that just didn't really sit right with me, was one thing. And then the second thing also was really didn't know how to do more than if this medicine didn't work and if this medicine didn't work. Now, I knew in my own personal life, I was very into stress management and diet and exercise and all the holistic things, but I didn't really do that with patients because, first of all, we don't have much time. And I didn't, in med school, we don't get any
Yes.
training for that. I think now they're maybe getting a little bit better, but back then we didn't, maybe we got half a day of nutrition lectures. I don't
Yeah.
even know if it was that much.
I don't remember that much. You're
Right.
absolutely right.
Definitely nothing about supplements, and exercise, none of that stuff. So that's why I ended up getting board certified in holistic. I also wanted to do it the right way. I didn't want to just kind of dabble in it a little bit here and there. I really wanted to understand it and know that I was practicing it, properly. And it's been wonderful because I can pair kind of the traditional model with the holistic model. I definitely don't believe in everything is, traditional or everything should be holistic. There's definitely a way to marry the two worlds, and I love it. And that's how I've been practicing for almost 15, 16 years now.
Awesome, awesome. Many people think that cardiologists just give medicines. They always just give medicines. So, kind of explain, what does holistic cardiology actually mean?
Yeah. So how I look at it is holistic is traditionally spelled with an H, but I put a U in front of it, right? So we can kind of look at the whole person. And because at the end of the day, I still might use medications, right? If I have to and we need it, then we use it. But the holistic part of me will say, okay, we have to use this medication. What's the lowest dose, lowest frequency we can use when it comes to the medication world? But before that, it's okay, let's go over your diet fully. Like, what are you actually eating? Not just, hey, eat healthy, see you in 6 months kind of thing, right? Because what does eat healthy mean nowadays? So it's kind of I really go into their diet in depth. I want to know everything from snacks to, what proteins and carbs and fats. So I go into that and kind of help people tweak what they can tweak in a reasonable way. I go into their supplements a lot because a lot of people are on supplements. And if you look at studies, majority of people aren't even telling their doctors they're on supplements because they're afraid of the backlash. And, a lot of doctors might not even know what things interact, with medications and what supplements are useful. And, now with social media, every supplement's going to make you live forever. So it's like, how do you tease that out? So I actually have my patients bring in their whole bag of supplements. I'm like, I want to see it. I want to see the front. I want to see the back. I actually want to see what you're taking. And then we obviously go over to the stress. The stress is, chronic stress is getting just more and more for people. Sleep habits, exercise. So holistic, I kind of look at all of that, right? And put it together with their labs and their symptoms and everything, and then come up with a plan.
Awesome. So I've noticed recently that we're seeing more heart disease in young people, and it's occurring. You see, people outwardly appear healthy, but
Yeah.
they may not be as healthy. Can you kind of speak to that? So, like, what are some of the big risk factors? What do you attribute that to?
Yeah. So as far as the question about, younger people, I think that there's multiple, being a physician, there's never one thing we can blame, right? It's always multiple things, right? And so I think one of the things is that we're seeing more and more diabetes and insulin resistance. Obesity and people being overweight is at the highest it's ever been. And that contributes to so many things: high blood pressure, high cholesterol, diabetes, and just being obese and overweight by itself, forget about all the things it causes, increases heart disease risk significantly, right? So that's one thing. I think stress is very much a big factor. It doesn't get addressed very often. Everyone I know is stressed out. So whether it's patients or friends. So I think chronic stress is definitely there. Our sleep habits, now, I mean, we've had the phone around for a while, but more and more, we're doom scrolling, as they call it, right before we go to bed. The sleep quality isn't as good. So I think those are just some of the few things that have contributed to the younger age group. And processed foods. It's so much easier to, go outside and I'm busy, I'm stressed. I'm just going to stop at whatever fast food is the fastest and eat my food, right? So we're consuming a lot more. Everything has to be quick and fast and let's go. And this is what I want now, and this is what I'm going to get. And, so I think that whole way of thinking has probably contributed to the fact that coronary disease we're seeing it sooner and sooner in people.
And obesity. And
Oh,
obesity.
yeah.
It's a rise of obesity because of all the processed foods. And we're just not
Absolutely.
taking the time
Yeah.
to prepare our own foods and get good foods.
100%. Exactly. And, as far as some of the risk factors, I think you asked also
Yes,
what to pay attention to and what might be getting missed. I think a lot of people don't really understand, some of just of the basic numbers, right? As far as,
right.
what is blood pressure?
Mhm.
What should your numbers be? Blood pressure can go undiagnosed, high blood pressure can go undiagnosed and silent for years before it's actually addressed, right? Think about if you go to your doctor once a year for your annual checkup and it's normal, but then or it's high, and then you're like, okay, it's probably just white coat, whatever. And then you don't get a recheck for a whole nother year. I mean, who knows? I really encourage all my patients to get a blood pressure machine at home,
Exactly.
like $30 on Amazon. I think sometimes some insurances cover it. I'm not quite
I
sure.
think so. Yes.
Yeah. And so, throw it on, get not a wrist one, an arm one, take a couple deep breaths, and they're automatic. You can push a little button and it literally takes like
Cross your legs.
yeah, uncross your legs. Don't be drinking coffee in the other hand.
No smoking before you
No,
take the blood.
definitely not smoking. Hopefully that's not even
Hopefully that's not an issue.
yeah. And it takes 2 minutes, right? And so
Right.
that way, and I tell people, check it once every couple weeks. So that way when
Mhm.
you do go to your doctors, you can say, hey, I check my blood pressures at home. It's this, right? So that's just one thing. And then I think the other risk factors, we don't know. A lot of people don't even know that they're pre-diabetic, let alone diabetic. But even if you're pre-diabetes, when we can actually start trying to make changes, people don't really know their numbers as far as what their basic A1C is or their insulin resistance. And then other risk factors, a lot of people think I look good on the outside, meaning, I'm a little bit heavy, but not bad. I exercise, I'm probably fine. I think that's what I hear the most common is,
Mhm.
but I exercise and I eat pretty good. Okay, that's great. But maybe there's something going on inside that you really just don't know. I mean, just some basic facts. 50% of people who have a heart attack, their first sign of having any heart disease was a heart attack. 1 in 2 people.
Wow.
So there's no warning sign. People think they're fine and they have a heart attack. Right. And
So I'm
so
going to put a pause right there in
please.
quotes.
Yeah. Right.
You hear the holistic cardiologist telling you 50% of the people, their first sign is a heart attack, and they think that they are okay.
Yeah. Yeah. And that's where, my passion besides holistic medicine and holistic cardiology is early detection and prevention, right? I mean, it's still the leading cause of death for men and women, right? We be, 1 in 4 women are going to die of heart disease. 1 in 30 women die of breast cancer, right? And the heart disease, we're making a little bit of progress, but we're still not doing
And
great.
so, with what you just said, 1 in 4 women die of heart disease. And what's the comma? That's preventable.
Yeah, absolutely. So if you really look at 80% of heart disease is preventable, you know,
Preventable.
preventable. And if you think about it, we have prevention for so many things. People get mammograms every year. They don't have a symptom and then get a mammogram, right? They get
Right.
colonoscopies every whatever it is, 5 to 10 years. They're not having a symptom, it's screening. But
Right.
we don't really have that in the leading cause of death,
The
you know?
leading cause of death.
The leading
Right.
cause of death, we have the tools, but it's not a standard of care to do the early detection and start preventing early. Medicines become very much reactive, right?
Right.
Hey, see me when
Yes.
you have a problem, see me when your blood pressure's high, see me if you have symptoms. We need to switch it to proactive, especially for heart disease, so we can actually affect change early enough before the heart attack happens.
Before the
You know?
heart attack happens.
Yeah.
So 50% don't get a sign. So what are some of the warning signs the other 50% get?
Yeah. So the warning signs, are obviously the most typical that people know. There's a heaviness or a tightness, sitting on your chest. That's the most common one that people know about, but that's not the only one, right? So a lot of times when people are more winded, meaning they're more short of breath, they're, breathing a little heavier, jaw pain, right?
Mm-hmm.
Nausea, sweating a little bit more, arm pain, and fatigue, right? 30% of women have fatigue as their sign. Now, what woman's not tired, right? I mean, everyone's running around tired. But, the key is if you've been, having fatigue or windedness for 10 years, right? You probably haven't been having a heart attack, obviously, for 10 years. But what I say to people is, I'm seeing you once in 6 months or once a year or whatever it is. You know your body better than anyone else. So if you say to yourself, 6 months ago, I was able to walk a couple blocks and I was fine. And now I'm walking a couple blocks and something doesn't feel right. I'm a little bit more tired. I'm a little bit more winded. It's kind of this gradual decline. People think that, okay, I'm going to be fine and then not fine. But there are things in between that can be caught. And I always say, if you're feeling something different for you in the past 3 months, 6 months, 9 months, even a year, get checked out. Why not?
Prevention. Why
Prevention.
not?
Exactly.
So we hear a lot about this cholesterol thing.
Yeah.
How much is it the whole story, or how much should we worry about cholesterol?
Yeah. And I'm assuming you mean the cholesterol labs.
Yes, the
Yes. Okay.
cholesterol labs.
Yeah. That's a great
Elevated cholesterol, elevated LDL.
elevated LDL, right? So what's funny is that, we've been using the same lipid panel, the standard 4 numbers for, I don't know, 50 years, right?
Yes.
And the LDL most of the time is a calculated number, right? And so we've been kind of going by this basic lipid panel for so long. It's 2026. We need to get with the times, right? Even the guidelines have finally caught up with the times. So I don't really ever go by just a standard lipid panel. I always order an advanced lipid panel on patients because, just as you asked in your question, there is a lot more that goes into building up plaque than just LDL. A lot more, right? So we know that LDL is just one of the markers that can increase plaque. There's a lot of them. ApoB is on all of the cholesterol particles that can cause plaque. So I follow ApoB even more than I follow LDL. Okay. And then we also know that there's genetics. There's a sticky protein called lipoprotein A that you either have it or you don't have it. It's inherited. And so if you have it, it puts you at 3 to 4 times higher risk, even with a normal LDL and ApoB and all that. And then what about inflammation, right? So we got to look at the inflammatory markers. What's actually going on? Okay, now if you have high cholesterol or you don't have high cholesterol, which is that ApoB, is it sticky? Is it inflamed? And then we also have to look at insulin resistance, the pre-diabetes. So I kind of look at, you got to look at all of those markers, not just here's your LDL, let's lower it, or you're fine. There's so much more that goes into what causes the plaque than just one number.
So is our insurances covering the lipoprotein?
I think so. I order it on all my patients for the
Okay.
past 15
Okay.
years. I haven't had any pushback
Pushback.
or any patients tell
Okay.
me, and now it's in the guidelines. So
Right.
I'm thinking that the insurance companies should catch up with it. But
Okay.
I haven't had any feedback
Any pushback.
for getting
So
that.
my green followers, listen to, she's giving you the guidelines. So this is part about being an advocate for yourself. If you notice your primary care is only ordering the basic lipid profile, please speak up and have them to order the full profile as she listed.
And
ApoB,
yeah,
lipoprotein
right.
A,
So
and
ApoB, get your high sensitivity CRP, which is a great marker of
right.
inflammation. Get your lipoprotein A checked. And if your lipoprotein A it's a one-time check because it's genetic. You either have it or you don't have it. It's not something you keep checking. And then make sure, obviously, you want to get if you can get your insulin resistance score checked, that's even better than an A1C, because by the time your A1C is elevated and you're pre-diabetic or diabetic, you're having to try to figure out how to go backwards. But the insulin resistance score actually shows us years before that starts happening, hey, you need to start working on diet now. Otherwise, you are headed towards diabetes.
Awesome. That is phenomenal. Okay. So, can a person have normal labs and be at a risk for a heart disease? Normal meaning if they go to their yearly physical and they tell them, oh, your labs were normal.
Yeah. Yeah. And that's such a great question. So, again, when we talked about labs, if let's say you just have only had a standard lipid panel, which is what most people have had, right? And if your LDL is, 100, 120, 130, which a lot of people say is normal, you absolutely can have coronary disease, right? So we know that. Let's break this down a little bit more. So when you're looking at a heart artery, okay, when you're looking at, think of it as a pipe of water, okay? 60 to 80% of people who have a heart attack, their blockage was 30 to 40 to 50%. They weren't running around with like a 70, 80% and then they had a heart attack. They were running around with a 25%, a 30%. They were in the mild category. And when that plaque ruptures, that's when you can go from a 30, 40% to 100% blockage, and then you have a heart attack. Okay, so now if you have a stress test, a lot of people come to me and say, I passed a stress test. Okay, great. But guess what? Stress tests will only identify severe blockages. That's what it's designed to do. It was never designed to say, do you have blockage or not? So when it comes to prevention and cholesterol, I am a big fan of getting advanced testing as well, because, okay, I have so many patients, right, doing the holistic, I don't want drugs, I don't want statins, right? I mean, I hear that every
Right.
day, all day, right? I'm like, okay, let's see what do you have going on in you? Because I'm different than the next person, right? And that's also where the holistic preventative goes. I can't treat everybody the same. Your genetics are different, your gut bacteria is different, everything is different. So how can I treat you the same way as the next person with the same exact number? If you have the same number as the next person, I can't treat you guys the same way. I have to look a little bit deeper, right? So that's where we look at the advanced lipid panel and kind of see, okay, your LDL might be okay, but guess what? You have this lipoprotein A. So even though your LDL is normal, your lipoprotein A is showing that you're going to be at much higher risk than somebody who doesn't have it. Okay. Or the next person, your LDL is really high, but it's not sticky. It's not inflamed. Your insulin resistance is great. And your arteries, when we get a scan, look great. I don't need to jump up and down and put you on a bunch of drugs just because your number is high. So when you got to look at, again, that holistic with that W, you got to look at everything. How can you just look at one lipid panel and say you're fine? There's a lot more that goes into it. And that's where some of the scanning comes in as well.
Okay. So you mentioned the scanning. What's the scanning?
Yeah. So the basic, thank God we finally started doing calcium scoring testing. That came out, maybe about 10, 15 years ago, maybe longer, but it's becoming a little bit more, people are more using it. Now, I personally love the calcium score. I don't really order it as much. I'd still order it because it's a great basic test. But again, it's a more of a scratching the surface test because it does look at plaque, but it only looks at the hard plaque, right? So when you look at, it only looks at the hard plaque. So again, back to my, you got an artery, you got a pipe, and the soft, mushy plaque, which is like sludge, right? That is what can rupture more. And when you have hard rocks on the bottom of your pipe, those are more stable. They don't really rupture. You can't really make a rock rupture. That's akin to the calcium scoring, what it shows. So calcium score.
Wow. Okay. Yeah. I didn't know that. Okay.
Yeah. So calcium scores only show us the hard calcium.
Hard plaque.
It does not show us a soft plaque, right? So I read coronary CTs. I'm board certified in it, and I read so many, and it's really amazing what I've seen. And you have like 60-year-olds and 50-year-olds whose calcium scores are 0, but they still have soft plaque. And so if you just go by a calcium score only, then you might be missing that preventative approach because you're like, oh, your calcium score is 0, your cholesterol is fine, don't worry about it. Maybe not. Now, the caveat with all of these testing is there is some radiation, with the CATs, with very low radiation for calcium scores. It's like getting a mammogram, right? And a calcium score is not something you're getting every day or every year, in fact. But it is cheaper than getting the next layer test, which is a CAT scan with contrast. So the CAT scan with contrast, which is called a coronary CTA, actually shows everything: hard plaque, soft plaque, percentage blockages. It shows the whole picture. Now, we've come down a lot with the pricing, and insurance companies are covering the scan way more than they did in the past. So in my patients, the calcium score is still not covered by insurance companies, crazily enough, right? It's about $100.
Yeah.
Yeah, $99. But the CAT scan now, the cash price I've seen about $400. So some patients are like, I'd rather spend a couple hundred more and I get so much more information.
Exactly.
But insurance companies are actually covering CAT scans now more. So to me, if I could only get a calcium score, listen, that's better than nothing, right?
Right.
Because if I do see an elevated calcium score, then I know, hey, you have hard plaque, but you most likely have soft plaque too. Because if you have hard plaque, most people have soft plaque that goes along with it, right?
So does soft plaque turn into hard plaque?
Yeah, it can. So there's different ways. So when we have soft plaque, right? So that's the next question. Hey, I got a scan. I have soft plaque. What do I do? Mm-hmm. So ideally, we'd like to reverse the soft plaque. If we can regress or reverse it. And if we can do that, that's great. And the next step would be, how can we even stabilize it? So if we can stabilize it, turn it into hard plaque, or reverse it, those are kind of our goals, right?
Your goal. Okay.
Yeah, right? Once we get that and we know that, that's when we go back to the numbers and say, okay, if we want to reverse or regress plaque, we got to get the ApoB number like we talked about, which is the particle that's on every cholesterol particle that causes plaque. We need that ApoB to be in the 50s or 60s, okay, if we're trying to reverse and regress plaque. So at least then we have goals. That's the other thing I tell people is like, if you're on medications, I'm like, what's your goal? Like, what number are you trying to get to? And most patients are like, I don't know, but how would you know until you know what's going on inside?
Right. Awesome. Okay. That's a lot of information.
I know it's a lot. Sorry.
Yeah. The good part about it is you can rerun go back through this video, right? Take your notes, and you have all the information to present to your primary care and your cardiologist for referral.
Yes.
So let's talk about the insulin resistance and the role it plays.
Okay. Yeah. So insulin resistance basically, anytime we eat, right, any sort of food, our pancreas is designed to secrete insulin because that's what it's supposed to do. And when we secrete insulin, the goal is to take up all the sugars and the glucose and, the carbohydrates and all that and convert it to energy and, and utilize it. But if we are kind of overdoing what our body needs with the carbs and the sugars and all of that, insulin keeps rising and our body is like, wait, I don't need all this energy. I'm not doing anything. I'm about to go to bed. Right. And so that's when you can become insulin resistant because it just keeps pumping out and the sugar, where is it going to go? There's nowhere needed to go. So the insulin goes up and it starts becoming resistant. So now when people become insulin resistant and the insulin levels go up, it starts damaging the heart artery wall. Okay. And so once we have the damage to that endothelial lining, that's when the plaque and the cholesterol can start sticking to it and start accumulating it and causing inflammation. So that's, the basics of how insulin and insulin resistance can damage our heart arteries and cause plaque.
So now we've heard all the pathophysiology of these diseases of cardiovascular disease. Now let's talk from a holistic standpoint. What are some of the most powerful lifestyle changes we can make to reduce our heart disease risk?
Absolutely. So when I said 80% is preventable, right? Like, what does that mean? So diet wise, right? So diet is one of the biggest things. I am not personally a fan of diets. There's so many out there, and most of the time it's very hard to stick to a diet. So really the one that is sustainable for you in a healthy way is going to be the best one. Now, if you look at lifestyles, Mediterranean's been studied, over and over and over again, right? And so we're looking at legumes, we're looking at vegetables, we're looking at healthy fats like olive oil and avocado oil. We're looking at, plant-based proteins, some, nuts, seeds, all those kind of things are really healthy for you. And again, it's a lifestyle, right? So there's actually been really good studies to show I get this question every day, right? And I'm sure you do too.
Yes.
But I'm carnivore, and I'm this and I'm that, and, red meat's not bad, white meat's not bad. There's so much. I mean, it's almost mind-boggling how much stuff is out there. And what I'll say is this, right? When they've actually looked at studies with people who eat red meat or white meat, and they paired it with people who had high saturated fat, right? So they are eating this meat, but then they're also having butter and cheese and, whatever, all the things that go into it. Their ApoB went way up. Okay. Now, if they ate the red meat and white meat, but they kind of kept their saturated fat low, their ApoB went up, but just a little bit, right? Didn't go up as much. The only diet that lowered ApoB, the only one, was plant-based protein and low saturated fats. Okay. So if you're eating plant-based proteins, and I'm talking about beans, tofu, that kind of stuff, right?
Not processed.
Not processed. Absolutely. We're going to
talk
about processed in a second. That's a whole nother ballgame.
That's a whole nother.
And if you eat plant-based protein, but you have high saturated fat, let's say you're eating tofu, but putting a bunch of butter on it, you're going to you're going to still have problems with your ApoB. So, it's eating clean proteins. Soy is okay. There's this whole myth about soy and then it's a myth. Okay. I mean, you can eat clean soy products. So when my patients want to go more vegan or vegetarian, but then they're eating like, the fake meats and the soy protein isolates and the process, it's so processed then, right? The fake cheeses and stuff. And even the meats, when you eat ultra processed meat, it is, I'm talking salami and the bacons and the sausages, that is horrible for you. You will raise your risk of heart disease by almost 30% just eating that kind of food. And then you're looking at sugars and really high sugary food. Everything's got sugar in it, right? So you got to pay attention to sugars in the food that they added sugars, and really, the carbohydrates that are just ultra processed and full of just sugar and carbohydrates and just processed foods. So it's eating whole, clean foods. That's really going to be the best way. And no one's going to be 100%, right? We all have to
Right,
learn
right,
how to be 80/20.
right. So now let's talk about how chronic stress
Yeah.
biologically damages your cardiovascular system.
Right. So, chronic stress, we know, raises your adrenaline levels, it raises your cortisol levels, and both of those can wreak havoc in the heart arteries, right? So we know adrenaline, most of us have felt that fight or flight, where we feel our, face get flushed and, our palms get tingly and our blood pressure goes up. Well, that's what we feel. Imagine what's actually going on inside our heart arteries, right? So our arteries are getting more constricted. Our platelets, which is a sticky part of our blood, gets more sticky, right? And they've even seen it down to the DNA level with where it accelerates aging when you have high levels of cortisol and adrenaline just kind of pumping throughout your body. And, let's face it, it's not about necessarily just getting rid of the stress. Sometimes it is when there's things that we do have to change, but most things in our life that cause us stress, they're there. We can't really get rid of them, right? And so it's kind of about balancing the stress response and then the relaxation response. And the relaxation response is what helps dilate out the arteries, makes our sticky platelets calm down, makes our DNA more anti-aging. So it's finding this balance of, and most people are kind of living really high with their stress response and not, there's not much going on with the relaxation response. So it's learning how to balance them. And it can be simple things like going for a walk, doing some heavy, some deep breathing, having a gratitude journal, being with friends, reading a book. There's a lot of
Meditation.
meditation. Absolutely. So,
Right.
yeah, but chronic stress is a real thing. I mean, it's equivalent risk factor for heart disease, just like high blood pressure. So we cannot blow this off.
So let's talk about sleep, how that helps.
Yeah. So sleep, I mean, when the quality of sleep and the quantity is not good, you are, first of all, there's a couple things, right? You're going to spike your cortisol levels. Most people who don't sleep well are hungrier. Then you're just kind of eating, we're just eating whatever foods. And that damage to the heart arteries can happen, when you're not sleeping well because of that cortisol response. And even if you have sleep apnea sometimes, you're not sleeping well because of that, the oxygen levels that are going down in your heart and heart artery. So, I mean, and it's hard. Sleep is hard to get. A lot of people, we're watching TV until late hours of the night. So it's just kind of developing, it's discipline like everything else. It's developing those discipline muscles of, okay, nope, I'm shutting this down at 9 p.m. I'm going to read a book. I'm going to take some deep breaths, spend time with my partner, no TV, no phone, just getting into those habits, and exercising during the day helps people sleep actually. So if you can exercise during the day, it will make you tired and hopefully you'll sleep better.
So that leads into how exercise is very important in your cardiovascular health. So what is the recommendation now for
Yeah.
exercise?
So when we talked about the preventative, right? So
Yes.
part of it is the diet, and the other piece of it is the exercise, right? I mean, obviously, the
Mhm.
sleep and stress are parts of it as well, but exercise and diet are a big chunk of the prevention part. So exercise. So I usually talk to people about try to have like 4 little buckets of exercise, right? That they
Okay.
can try to get. The first one is going to be walking. Okay. Just getting your steps in, and if you can't do it all at one time, go a couple times a day for 10-minute walks.
Oh,
It's getting hot out in Florida, go inside. There's a lot of
right.
ways to get your steps, huh?
Walk inside. Right.
Yeah. Walk wherever, go to the Walmart or whatever. That's a
Right.
big store, So
Costco.
Costco, right? Oh, that's even bigger. So that's one big thing that is really important, is just kind of getting your basic steps in. And
Hmm.
then the second, that if someone's like, okay, I'm already doing that, now what should I do? Right? Is gonna
So before you go to the
Yeah.
next,
Yeah.
these steps, how do people know how many steps to do?
So, that's a good question. I wear a Fitbit,
Okay.
just only because I don't know. I mean, I would never be able to guess how many steps I get in a day. It's kind of like when
Okay.
you're just like when we talked about food and,
Hmm.
watching what you're eating, how would you know unless you're looking at the label? What the heck is in it, right? Or
Right.
if you're trying to portion control, I don't know what 2 ounces looks like. I have to
Right.
wait. I don't know. So same thing with the steps. Like that's why personally, I wear a Fitbit. I think the iPhones and some of those phones, if you put it in your
Yes, they
pocket,
do.
It
Hmm.
will measure it, right? So there's ways. I say try to get at least 7,000 a day, at least in the
Okay.
average. Let's say there's a day you only got 5,000, make it up.
Okay.
Make it up. Like on Saturday, that's my makeup day. So if I haven't done good that week, I guess I'm walking a lot on Saturday.
Saturday. And there is a free step app that will connect to your iPhone. It's called Steps.
Okay,
Yes.
perfect. That's
Okay.
wonderful. So that's one piece of the puzzle,
That's
right?
one piece. Okay.
That's one piece. The second piece is resistance training.
Hmm.
So, especially as we get older, our muscle mass goes very quickly. Bone health, balance, stability, mobility, all those things. And we have to get our muscles strong in order to keep our frame up and our bones healthy. So I'm a big fan of getting resistance or weight training at least twice a week. It can be with dumbbells, it can be with bands. There's a lot of ways of pushing your muscles. And I think that's very, very, very important, especially as we
Awesome.
get older, right? So they've seen resistance training lower heart disease risk by like 15, 20% just by itself.
Wow.
Yeah.
Okay.
And then the cardio comes in, right? So
Yes.
cardiovascular health. And so we used to always talk about cardio, 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 but actually it's a combination of the strength training that I just talked about with the cardio that has a 50% reduction in heart disease.
Wow.
Yeah, but
50% reduction.
yep, more than most medications, right? So if you
Right.
combine that with the diet, imagine, how
Yeah.
good you would be. So when it comes to cardio, there's a
Hmm.
couple different things that have been shown, right? So one is like interval training. So
Okay.
interval training is really, really good for cardiovascular health. And that's not something you need to do every day. That's something you do like a couple times a week, and you do it for like 20 minutes. You go really hard on something. It can be anything. It can be, if you're a swimmer, you can swim as hard as you can for a minute and then you recover for a full minute. You
Hmm.
can go jump rope. You can go on a bike, on a bike. You can run. You can, I have some of my elderly patients who I just tell them to shadow box as hard as they can for a minute. Yeah,
Okay.
shadow
Okay.
box. You get up and down on a chair for a minute,
Hmm.
right? And then you recover for a minute. And you do that cycle hard and recovery like 10 times. And that's only twice a week. So that's been really helpful for reducing, helping in the cardiovascular world and reducing risk. And then, of course, if you want to go for a run or a swim or, whatever, that's all great and that's additive. But if you can at least get the steps in, the intervals, the resistance training, those are wonderful things to just start the process of helping yourself.
Okay. And then last, we talked about, you kind of touched on it previously, that there is a balance between holistic medicine and traditional cardiology, and it's not either or. So you speak to that?
Yeah. So, I mean, again, so let's say, right, you have plaque, you had the scan, you find out you've got some blockage, you want to work on it, right? So you do the diet as best as you can. You exercise as much as you can. You're managing your stress as much as you can. And let's say we recheck all the numbers and you've gotten better with your ApoB and your insulin and all those things, but you're just still not at goal because of genetics play a role still too, right? So if you're like, listen, I'm hitting a wall now with all my lifestyle. I've gotten better, but I'm still not where I need to be in order to prevent this heart attack because I know I have something going on here. That's when the medications come in, right? So let's do all these things, maybe add some supplements even, right? And if despite all of that, we're still gotten better, but not at goal. That's why you got to have goals of where do you want to see yourself as far as your numbers go. If you're still not at goal, that's where the medications come in, right? So it's like, we need help with these medications. And that's where let's try the lowest dose. Let's see how you do, and then let's recheck. Let's recheck your numbers. Did it help? Did it not help? It doesn't mean we take away all the lifestyle stuff because that's in addition, right?
Right.
Yeah. So it's kind of
Awesome.
pairing those things. Yeah.
Awesome. So, what message would you like listeners to remember in preventing heart disease?
Yeah. So I think the main thing is advocate, like Dr. Jones said, for yourself, because if you don't ask sometimes in this medical world, doctors don't have a lot of time to give. And it's kind of, check, check, check and see you in a year. Advocate for yourself. Ask for the numbers that you want, ApoB, inflammation markers, lipoprotein A. Get the scans that are appropriate for you. Check your blood pressures a couple times a month. and get moving, walk, start paying attention to the food. Pay attention to the food because it's now everything is labeled. You can see exactly what
Yes.
things are in it. You know, you want clean ingredients and whole foods, and get help if you need it. Now there's all kinds of stuff online about, you know, chat GPT, ask, you know, give me
Yes.
some Mediterranean, you know, recipes.
Yes.
And so advocate for yourself. Yeah. I mean, I think that's the biggest thing.
Awesome. So where can people learn more about your work and your practice? Can you tell us a little about that?
Yeah, so I left traditional medicine, and because I really, what I do, I spend an hour and a half with my patients. And so I started more of a concierge type model where I don't take insurance for my visits. I still use insurance for testing and labs, but I really didn't want to be locked down by insurance companies telling me how much time I needed to spend with patients. So that's my model. It's One Heart Cardiology. My website is drmonashah.com. But I've also started a YouTube channel. So I have a lot of information on there about everything Dr. Jones and I talked about. I've actually gone into, you know, they're like 10-minute videos on what a stress test shows, what is plaque, you know, what are your cholesterol numbers, what is insulin resistance. And that on YouTube is at Dr. Mona Shah, MD. So you can find me on YouTube as well. I have a blog that's drmonashah.wordpress.com for people who like to read instead of watching or listening. So I'm on Instagram as well at Dr. Mona Shah MD. So there's lots of ways I talk about everything that I've talked about today on those platforms as well. If you can't see me as a patient, there's lots of ways to get my information as well.
Oh, well, thank you for joining us on the Healthy You, and take care, everyone, and tune in. Go see her on her websites, on her YouTube channel, the blogs, the podcasts, everything, because being healthy is life saving. Have a great day.